Hi.
I'm Ingrid. Thanks for checking in. I'm a small animal vet with. Oops, picture's gone. Picture's back. I'm a small animal vet, and I specialise in behavioural medicine. And I'll get Zoe to do the intro
and
as well.
I'm Zoe. I am a veterinary nurse of 28 years and a behavioural dog trainer of about 15 years. My special interest is helping dogs and helping people to understand their dogs better. So Ingrid and I are going to have a chat today about some questions that we've been given.
Okay, so we've put together a few questions that are very commonly asked. So some are more health related, some are more behaviour related, and there's a bit of overlap in some of them. And then if there's time at the end and there's some live questions, we may be able to take some of those as well. So believe it or not, one of the most common questions that's asked is, how do I know if my dog has dental disease or just a smelly breath? Okay, so it's a very broad question, and I would say that if your dog has a smelly breath occasionally, that happens. So, dogs pick up things and chew on them that may not smell so great. If your dog has smelly breath all the time, then there's something wrong. Okay, so if every time you get close to your dog's face you can smell their breath, then it's time to go and see your vet. Dental disease is the most common cause. Okay, so dental disease is quite common in dogs and cats, and the most common cause for smelly breath. There's a few other medical reasons that are less common, but again, unfortunately there is no easy way to tell, and you have to go and see your vet to get it checked out. Zoe's got a bit more about dental health and also how we can help our dogs to maintain healthy teeth.
Yeah, absolutely. So dental health is important, just like Ingrid has said, just like the overall health of your pet. So just like humans, dogs can have a build-up of plaque, which can calcify and create calculus. So we can do home care, so brushing our teeth daily is obviously the gold standard. Giving dental chews is really helpful. There's also additives that you can pop into their water. There's also dental food that we can use. It's really important to see your vet once. Ideally, dogs should have a scale and polish once a year, or have their mouth checked once a year. Other ways that we can help them, as I said, is brushing their teeth daily with a safe pet toothpaste, so not a human one, and a nice soft brush. We can teach our dogs and pets to enjoy this through cooperative care. So our dogs and pets having a say in it, not just having it forced upon them. Teaching pets to have a say in their care is super powerful, and the results are amazing. Having annual oral exams, x-rays and a scale and polish under general anaesthetic is really important. And as I said, using appropriate chews is a great benefit as well, not just for dental disease, but helping our dogs stay nice and calm. So that's our question on dental disease. Our next question is on arthritis, and what are the best ways to help my dog with arthritis?
Okay, again, pretty broad. So I've got a few thoughts on that. The first one is, do you actually know your dog has arthritis? So because it's something that commonly happens to our dogs, especially if they're very active or if they get older, a lot of people, when they see their dog's not moving right or is a little bit lame or limpy, they just assume the dog has arthritis because, we expect it to happen. So if you think your dog has arthritis, so if your dog, is a bit stiff or is limping after they had exercise or when they get up in the morning, and you haven't done that, again, the first step is to go and just make a vet appointment. Go and have your vet check over your dog. I often still recommend x-rays, okay? Most of the time, if we see arthritis, it's not You know, it's not the worst thing that can happen, but there's just a few things that, again, don't happen very often. But if we don't x-ray, we don't know, and we might miss them. And if we delay the treatment, it can be late. So things like lumbar stenosis, so where between the vertebrae, space between the vertebrae in the back of the end of the back gets quite narrow, or there's a few things like, unfortunately, bone cancer that in the beginning may just look like arthritis. The dog's just being a little bit lame and sore, and obviously it's a lot more serious than just your normal joint degeneration. So, okay, now we've cleared up. We know your dog has arthritis. The next step is to, start doing something about it. Do not. So I often find people are hesitant to start anti-inflammatory pain medication because there's some concerns, about how they affect health. But what I often see is that people wait too long. What happens if we don't use good pain medication that helps with the inflammation and makes the dog feel comfortable? Then they won't use their legs properly. They will not move properly, and their muscles will start to waste. Once the muscles start to waste, there's even more stress on the joints. So you get into like a vicious cycle, and then it's really hard to reverse muscle loss once it's happened. So please don't wait to start pain medication. Another thing that what I really find is great is go see a physio or see a rehab vet. Okay, I know this is not very common yet for our pets, but it's actually highly effective. So my dogs go to hydrotherapy once a week. So they go and walk on the underwater treadmill, which is a great way with no joint impact to build and maintain muscle. So one of my dogs is he's 11 and he's still a working search and rescue dog. He does that. They also do conditioning training. So basically it's like gym training for dogs. And once you've seen the physio or the vet or the rehab vet and they show you how to do it, you can continue that at home. And it works really, really well to keep all the dogs strong and mobile. So keeping your dog active is important, and Zoe will just have a few tips on how to do that best for dogs that have arthritis.
Yeah, so it's still important to keep our dogs moving for their arthritis as well as their mental health. So some things that you can do with that is low impact exercise, using a ramp or stairs to get in and out of the car or on furniture, just so that they're not jumping, just to alleviate any pressure that's happening with that. Non-slip mats throughout the house so that they've got traction, so that they're not slipping and sliding everywhere, causing more pain and discomfort. Lots of sniffing walks, so your walk doesn't have to, be about distance. It can be about just letting them have a sniff of different things. If they're not up for going for a walk, you can definitely bring different smells into the house to let them, get some enrichment that way. There's lots of sniffing games that you can do. Canine nosework classes where they don't have a lot of moving around, but lots of mental stimulation, and it's great for that low impact. It's also good for dogs that are recovering from surgery as well. So recently one of my dogs had bilateral elbow dysplasia, so couldn't do a lot of stuff, but lots of sniffing games and calm walks, just like if he had arthritis. Okay, so our next question is, how much should I feed my dog each day to stop them from becoming overweight? Over to Ingrid.
So, okay. Now, again, that really depends. Dogs are no different when it comes to diet and amount of eating and weight loss or weight gain than we are as people. So there's a lot of factors that will come into that. Okay, so it'll depend on the activity levels, obviously. So is your dog going for an hour walk every day, or does your dog spend most of its time on the couch? Obviously the dog that exercises more, generally uses more and will need more food. Breed will play a little bit of a role for the same reason. So some dogs are, naturally active. Some dogs just prefer to move a little less. So, for example, a border collie of the same weight as, let's say, a basset will probably eat quite a bit more without putting on weight. So keep that in mind when you think about it. Think about how much to feed your dog. I think that, again, important to, before you go down that path, is to know, is your dog at a healthy weight in the first place? So being in practice, probably at least half the dogs, or maybe more than that, are overweight. So they are like either just on top of the normal weight range or over, or just over, and obviously then we have a percentage that are highly overweight or obese. And when I talk to people, most people are just not aware that the dog's actually overweight. I think often we see a lot of dogs that are not a normal or lean body weight, and we think what we see is normal because it's common. And that means that, we look at our dogs and they're like, oh, their weight's probably fine, but it may not. So there's obviously, it's a good start to check when you take them in for their annual vet check. Have a chat to your vet about their weight. Put them on the scales so you have a number, and then also, can you look at them and see that they have a shape. So look from above, they should have a waist. If you look from the side, they should have a tuck in the abdomen. You should be able to feel the ribs fairly easily. So when you don't have to see them, but when you run along the sides, and you can feel the lips without putting pressure onto the chest, then for most dogs that's a good body weight. Okay, so now we know the dogs, what weight the dogs are at. We look at activity levels. The next step would be to look at what are you feeding. Most dog foods will come with recommendations. So it will let you know, okay, so a 20 kilo dog should be getting, let's say, 2 cups. That might be different if it's fresh food or frozen food, but we'll still usually give you an idea. And that's generally a good place to start. I like to tell people, that's what you feed your dog that's, let's say that's 20 kilos and is getting a good amount of exercise. If your dog's not getting that amount of exercise, or if your dog's a little on the heavy side already, then I would reduce that by about 25%. Okay. A lot of the time we will use food throughout the day for training or enrichment, and Zoe's got a few things to tell us about there.
So for dogs that are possibly overweight, or if there's a multi-people household, sometimes it's easier to get a designated container and put the dog's daily quantity of food in that, so that everyone can take the food out of that and not everyone's giving, separate amounts of food, so you can keep on track of what your dog's eating. I highly recommend enrichment feeding, so getting rid of your food bowl. Food bowls are boring. No dog in the wild would just, have an amount of food. They would have to hunt for their food, so there's activity involved. So the idea of enrichment, toys and feeding, is to create some mental stimulation as well, so it's not just about gulping down that food, so it's slowing down the food. And I find that dogs are much happier with that. And feeding a really good quality food is always really important as well. But as Ingrid said, talk to your vet or the nurses that are at the clinic that you're at, and they can definitely help you decide whether your pet's overweight and if you need to do anything about it. So now we get down to some more trickier questions, so some of our behavioural questions that we've been asked. So the first one is, how do I stop my dog from going crazy when they see other dogs? So I'm going to let Ingrid start, and then I will come in the end with some extra information.
So, okay. So, again, that's like, I don't think I've said that for every question now so far, but it depends. So we'll go through some more specific examples and how, what you can do about when your dog goes crazy when they see other dogs. But generally, it'll depend a bit on what do you understand. So what is it they're going? It will depend. Are they going crazy in? They want to just run up to everyone and say hello and jump up and lick them, or is it more they go crazy because they're not comfortable with the other dogs and want to push them away and would possibly growl, bite, lunge at them if they have a chance to do so. So that's just two quite different motivations on why dogs may go crazy when they see other dogs. And yeah, a little bit hard to do, but generally, so the first thing I do recommend from a behavioural standpoint is management. Okay, so before or while you figure out what to do about it, while you talk to your trainer or behaviourist or behaviour vet and about a plan on how to make your dog feel differently or behave differently around the other dogs, managing the exposure is really important. So we try to, especially in the beginning while we start working on it, what we try to do is to limit exposure. Okay. So just go out walking when you think at times where there's maybe less other dogs around. Don't go when you know you're going to walk past other dogs every 20 metres on the sidewalk, because it's going to make life really difficult for you and your dog. So go early in the morning, go late at night. Drive to places where you can walk your dogs, maybe on a long line where they can have a bit of time, a room to stretch their legs, and you know that you're not going to meet other dogs. So that stress is taken out of the equation until we figure out a plan on how to go about it. Zoe's got a bit more details and about how to work on encounters and
so as Ingrid said, it's not a really super clear question in regards to, is the dog anxious about meeting other dogs, is it concerned about it, or does the dog just want to play with every other dog? So firstly, I highly encourage never having on-lead interactions. That's really important. I really stipulate that early in my puppy class. So the dogs don't have that expectation of greeting other dogs. Whether they're friendly or not, it's better to have off-lead play, but that's slightly different. Unless you're great at reading other dogs' body language and your own dog's body language. I highly recommend not having those on-lead interactions, so that expectation is never there that they're going to meet and greet other dogs and people even on lead. Most dogs don't want to interact with unknown dogs, just like you don't want to be going up and hugging everyone that you pass on the street. Our dogs are very similar in that aspect. So some things that we can do if it is just overexcitement in regards to wanting to play with other dogs is to start working on creating a focus on you becoming this amazing thing for your dog out and about in the world, because we're always competing with the environment, so we need to be really important to our dogs. Always take high value food with you when you go on your walk so that you can reinforce behaviours that you like. Walk where you can control the environment, like Ingrid was saying, open green spaces where you can see a dog 10 metres away, but if that's too close you can move further away. So giving the dog the choice to come with you rather than having to walk past really closely to that dog. So sometimes it might mean that you have to get in the car and drive somewhere. Also, like Ingrid said, start in a low populated area where there might be few to no dogs. You definitely don't want to take them to the market and expect them to be able to not react. So you'd work at a distance where your dog can see the dog but not act. So that's the ideal distance that you would start working, where you might reinforce the dog for looking at the dog and then looking back at you. Once this is established, knowing what point that your dog can, be near another dog but not react, that's where you would start to do your training. So it might be 10 metres for some dogs, might be 30 metres for others. It really depends, and we want to work with that individual dog to see where their threshold is. We want to reinforce our dog for re-engaging with us when they see another dog. It can be a very long process to train. With any behavioural problems, there's never a quick fix, there's no light switch. It takes time and dedication. And we also want to never push our dogs past the point that they're comfortable with. Sometimes I think that we as humans do is expect things to go a lot faster than they do. We can only teach at the speed of the learner. And I highly recommend, if you do have this problem, to contact a force-free trainer or a positive reinforcement trainer, someone that's going to help and guide both you and your dog to get where you want to go. Our next question, sorry, did you have something else?
No?
Good, thanks. Our next question is, how can I calm down my dog when I come home or have people over? And again, I'm going to throw it to Ingrid to start.
You like doing that?
I do like doing that.
Okay, so I guess what I see when I see this question is there's actually two questions in there. So the first one is like, how do I calm down my dog when I come home, and how do I calm down my dog when I have people over? It's kind of similar, but it can be like I would probably approach them a little differently. So the first thing I want to check out, if someone comes to me with that, if they refer to me with that problem, is the first thing is there an underlying mental health issue? And what I mean by that is that dogs that go absolutely crazy when you come home after they've been home during the day.
Or you've just gone to the letterbox.
Or you've just gone to the letterbox, that's true. It may actually have a degree of separation anxiety or separation distress, we call it. Means they actually get really concerned, and then when you come back, they're just beside themselves because you're finally back. And like Zoe said, sometimes you just went to the letterbox or maybe to the next room, depending on the dog. So the only way to really tell is to have a camera up when you are not there to watch your dog. Obviously, if you're there, it's not happening, and B, if you don't have the camera, you can't really tell, you can't observe. So now you can get pet cams or just normal like cheap CCTV setups really cheap. Just go to one of your retailers, and a lot of them you can even watch your dog on the phone while you're not there, as long as you have wireless internet at home, and that will give you a bit of an idea. Okay, so if your dog just goes to sleep, or plays with the toys or have a chew and then go to sleep after you leave, and pretty much doesn't do much at all until you come back, then it's very unlikely that they're worried about you leaving, and they're probably quite happy and content and happy to wait for you. But then, if you see things that are pretty much most things that are different from that can be concerning. So it might be as subtle as like pacing, so the dog gets up every few minutes and paces back and forth, or just stands and stares at doors for a long time, and then obviously progresses to the more common signs that we get or that people are aware of, is like vocalizing, whining, barking, and down to really, really unhappy dogs or really distressed dogs may become destructive, and to a point where they injure themselves in the being destructive. Okay, so so we've set that up. If you notice any of that needs to be addressed before you can work on your dog being calm when you arrive home. And then, so we've sorted that. We're just worried about the dog being calm when you come home. It's I think for me what comes to mind is, with a lot of those questions in general, is like, most of the time we are asked on how to stop something. So how do I stop this from happening? And my preferred answer is, what would you like to start happening? So what would you want your dog to do when you come home? And that's your starting point. So that's your starting point. Pick a behaviour. Zoe will talk a little bit more, and that's from where you can progress from. With people coming over, the same applies, but you might involve a little bit more management, because it's quite hard to get people to participate in your behaviour modification or training, and there is a risk of them undoing all your hard work if you don't throw some management in as well. I'll just hand over to Zoe for that one.
That is very true, actually, because a lot of people come in and say that, I don't mind that they're jumping, but in the end, we have to live with them, and it's not an ideal thing. Okay, so unfortunately, when we get puppies, a lot of the time, sometimes it starts from then, that we, have to go out and then we come back and, we've missed our puppy. So we get all excited and kind of rough them up and, kind of tell them that when we come home, they should get really hyper aroused, which isn't the ideal thing to do. Ideally, we want to, come in, be really calm, ask them how their day was, even though they're not going to answer you. But then give them a chew, give them a licking mat, give them a calming activity, so that you coming into the house or into the room isn't that key or that cue to become hyper aroused. So if we start it really early, that the expectation of us coming back isn't always that exciting, then that can definitely help set us up. We can later on, get them all excited. That's why we have dogs, is to enjoy them. So I'm definitely not saying you can't do that stuff, but it is a good idea to set that expectation early, that you coming in is not a super exciting thing. And you might have a Labrador puppy, and that's not going to be so much fun at 30 kilos when they're jumping at you when they're an adult. So we can often create frustration and mixed messages for our dogs. So we want to have that clear idea of what we want, like Ingrid said. So when I come home, I know my dogs are going to be excited, so I wouldn't expect them to sit at that particular time. As long as they're not jumping or lunging at me. If they're jumping around and excited, standing, I'm happy for that. So our expectation of what we want is really important. We need to know what we expect of our dogs as well. And again, like Ingrid said, excuse me, management is really important. So you might have a baby gate set up, or your puppy in a playpen. So again, they're not practicing those behaviours really early. Calming activities are really, really important. So calming activities are licking, chewing and sniffing. So I use a lot of those to keep arousal down. And it helps them stay in a learning zone where they can make better choices. We want to think about as Ingrid said, what we want the dog to do instead. We don't like the behaviour that they're doing, so let's focus on what we do want. Do you want them to go onto a mat? Are you happy like me that my dogs are standing but not jumping? So it's important to know that. Knowing what we want will then help us get towards our goal. When we start working towards our goal, we're going to do it again in small steps, like anything to do with behaviour, so that the dog understands and that they can succeed. And this is one thing that I actually have trouble with one of my dogs. Tonka does get very, very excited when people come over. So I use a lot of management, lots of calming activities, and just set that expectation of what I want from him to do. And maybe it takes him 20 minutes to half an hour to settle down, so that first 30 minutes, can be quite challenging. And I definitely make sure my guests know what is expected of them, so that that behaviour doesn't get reinforced. And again, work with a trainer. That's what we're here for, so that we can help, people get to their goal with things. Okay, we've got 2 more questions. So, what really works for dog anxiety? Ingrid, this one is you written all over it.
Okay, now, again, it really depends. So, dog, it will depend on a lot of factors. So I think the main thing I'm looking at is when is the dog anxious? So anxiety just means that your body is is on alert. Okay, so evolutionarily it makes sense because there's some situations you want to be anxious in because it puts you on high alert. That means you can react faster and either run away or if you don't have another choice, fight whatever's dangerous or threatening your life. So unfortunately we have retained that, so have our dogs. It's nowadays not so important anymore because there's not a lot of life-threatening dangers out and about, but our brains haven't got the message. So anxiety is still an issue, or it still happens and can become an issue depending on the case. So if your dog is a little bit anxious when they go into a situation that they're not so sure about and maybe had a previous not so great experience, so unfortunately the vet clinic comes to mind, then obviously it's important that we try to make them feel comfortable in that situation, but also appreciate, make them comfortable and make sure we don't do anything to make it worse, but also appreciate that it is normal to an extent. Okay, there will be situations that I'm anxious. Okay, maybe before Facebook Live I haven't done before, but it's okay and it's normal, and we're equipped to deal with it. When it becomes a problem is when the anxiety becomes either so strong that we see dogs that turn into like a panic response. So that can look like what you expect. It could be a panic response. So they can be, they just basically flip out, try to run away, try to get away, try to hide, possibly if they can't, don't have another choice. You may see some aggressive behaviours too. Also sometimes you get the dogs that just freeze. So that's probably the most overlooked one when it comes to anxiety and fear, is dogs that they just don't do anything. They're just immobile, they just stand there, they just lay there, they show no reaction, and they're actually terrified. But it's another pre-programmed response to danger, is if you pretend we basically not there, we don't do anything, the danger might go away. So if we get into these situations, or if that is happening, then definitely doing some targeted behaviour modification to make the dog feel more comfortable in the situations they're anxious in is really important. So we'll talk a little bit more about that. And then the second one we're looking at is dogs that are anxious all the time. So they basically cannot settle down, high alert all the time. When it comes to those dogs, behaviour modification is still important. But some of those dogs, when they come and see me, they actually need some medication. It's just like some humans do. When their mental health problems become more severe, the same applies to dogs. And often people are quite, they're quite surprised on what a difference it can make. I think the most important thing to keep in mind is that the medication alone will not make things go away, but it will help your dog to deal with anxiety if they're severely affected. And so we'll talk a little bit more about activities you can teach your dog to help them deal with their anxiety. It's really important to have it assessed to make sure that it isn't a separation or some other sort of anxiety. It's not a training issue as such. So we want to understand the cause of the anxiety so that we can best help the dog in front of us, because all dogs are going to be different.
We can start to work on teaching our dogs to do nothing, so just teaching them to relax, a really undervalued skill that I start teaching in puppy class, just that the dog is chilled and relaxed, really important. There might be just to lie on a mat or bed and be comfortable doing that. Some other things that we can do is to do an activity with our dog to increase their independence, problem-solving skills, just to make them more confident, because confident people, just as you know, the more confident you are, the more easy it is to tackle different things. It's the same with our dogs. We want them to be comfortable and independent, make good choices. So some things that I recommend are canine nose work, which I'm currently working with several dogs with anxiety in my nose work classes at the moment, and watching them improve and grow each week is great. And I love hearing from their owners each week and saying the little wins that they've had at home as well. So something really important to think about. Watching the owners get emotional when their dogs keep improving each week in seeing the difference in their confidence is just something incredible. So it's, you know, we can help these guys. Canine Noseworks doesn't discriminate, and almost all dogs can participate. So, you know, it is good for anxious dogs. It's a safe environment for humans and their dogs to continue to grow and learn. So yeah, anxiety, there are definitely some training things that we can do with it, but often we would work collaboratively, like a behavioural vet and a behaviour trainer, to get the best outcome for you and your pet. That one?
Yes.
Okay.
Last question.
Oh my goodness, yes. Do you want, I'll read it out.
Oh, I can read it.
Okay.
Anyway, okay. So this is way more specific. So that's a question that was sent to us prior to the Facebook Live, and so it's about a dachshund, and the person sent it in is asking about. So their 14-year-old healthy dachshund has huge separation anxiety. We can't stop him barking when we go to work. We're at our wits' end and how to help him, and we've had counsel on our back a lot. He wears a barking collar, has a bird house, and is on medication, but nothing works. We have tried different areas for him, and he has toys and the radio on. We have tried talking to him through the camera too. He's walked 5 days a week, and when the clients are home, that he doesn't bark. When I try to socialise him with other dogs, he wants to bite them. We were given the dog 2 years ago, and he's got worse with his barking. The former owner, who stays in touch, said that he wasn't like this before, but there was often somebody home, in and out throughout the day. So the question is, do you have any ideas how we can stop this happening? All right. So quite a severe one, and quite a difficult one, right? So the first thing I think is really important to know is any behaviour change that's sudden, especially in an older dog, is a huge red flag for medical problems. Okay, so I think I've just read through some papers not too long ago, not a few days ago, and it varies a bit, but the percentage of medical problems that are causing or contributing to behaviour problems in referral practice is something between 50 and 80%. So that's a huge amount. Okay, so again, the first thing is a full health check, and often dogs and cats or horses may appear healthy, but that doesn't mean there's no underlying medical issues. So for cases like this, it's not enough to just have a health check and a physical examination done. We need to look a bit deeper. So for the first thing would be to I recommend is a full pain assessment that often includes x-rays, and the second one is a full blood panel, and in all the animals always check urine as well. So the main things I'm looking for, there's many possible causes, but the main things I'm looking for is underlying pain, which is again the most common medical issues that underlies behaviour problems. And the pain can come from many different places. Obviously, musculoskeletal pain is the most common, so muscle and joint pain is the most common one we get, especially in older animals, and it can hugely contribute to any behaviour problems that we see. And then some of the hormonal changes can have a huge influence on behaviour as well. And then, if we start looking, we might get some clues on other things to look out for. Then the next step is, so once we've established that there is no underlying medical issues, or if there is underlying medical issues, we've started treating them, then we can look at the behaviour problem we're dealing with. I think the most important thing to keep in mind in a case like this is that it's quite a severe behaviour problem. The problem has been existing for at least 2 years. Okay, so I think please keep in mind there is not going to be a quick fix. I know that we would love to just be able to give the dog something or do something to make it stop, but unfortunately that's just not going to happen. So this dog, given underlying medical issues have been addressed, this dog will need a medication review. By the sounds of it, it may be a case for referral. So your vet can refer to behaviour vet or behaviour specialist. Unfortunately, we don't have any specialists at the moment in Brisbane, but a lot of them will do remote consults. So this is a case that definitely needs some review. And then what we'll have to do as well is look at behaviour modification and getting them comfortable being alone. And so it's got a few more tips as well to try to reduce the stress levels of this poor pup a bit if we can.
Okay, so it is a much more in-depth question, which is quite good in regards to how we can help. So the first thing I would be recommending is to remove all punishment-based products, so the bark collar, the birdhouse, because while they seem like for us as a human that they're going to work, they often can increase the problem. So I'm already, from the dog's perspective, I'm already concerned about being left alone, and when I show that I'm concerned, I get zapped either with a citronella spray in my face or with an electric shock. So then that increases my anxiety, so I'm more likely to get upset a lot quicker, anticipate it before you have even left the house. So removing those things to help the dog out would be my first thing. And the second thing, which is not easy, but is to not leave the dog alone. Like, it sounds like this particular dog has probably had someone with them 99% of its life. So all of a sudden not having that can be quite concerning. So there's doggy daycares that we can drop our dogs off at. I know that is a financial expense. Sometimes there's people that work from home that are quite happy for you to drop your dog off. So they've got some company and the dog's got company for the day. So things like that. So we don't want to leave this dog alone. That's just going to increase his anxiety. And I know that from studies that have shown, it can take 7 days for a dog to recover from one episode. So this poor dog's being triggered every day. He's never really getting that time to stop being stressed. They would be my little tips to start with.
Yeah. So that's it's quite in depth, and it's quite a severe problem, and a lot of factors play into that. So this dog's probably, or I'm pretty certain this dog is not getting anywhere near the sleep they need. This dog's probably not getting any throughout the day. Dogs should be sleeping around 16 hours a day, 16 to 18. And what happens if they don't, apart from dogs being stressed or being alone, is the same as it happens to us. So our threshold really drops. We're really easily upset, easily cranky, and just not able to deal with the world. So there's a lot of things going on here, and unfortunately, while there's a lot of things we need to do to help and can do to help, it's going to take a lot of commitment to help this dog out.
I see we have a question.
I've got a question.
Yeah.
Okay.
I'll let you
Right.
read that out.
All right. So we've got a question here. Click on that and make it worse.
Oh, yeah.
Okay. Okay. So we have a question here. Hello. I have an American Cross English Staffordshire 12-year-old since the dog was 6 weeks old. Dog's always been socialised, however, does turn on dogs if not watched. We also have Blue Heeler, which is 9 years old, since the dog was 6 months old. The Heeler is becoming very dominant, so much so he fights with the staff about attention. I try not to overcompensate with the staff. He's mine, given to me by my sister for my 50th. It makes it really uncomfortable that I can't spend time with my dog outside. Okay, so I'm not 100% on the living situation. So I assume the dogs are okay when you are not there, and only is how you read it. And they only fight when the person's there. Okay, so again. So we'll talk a bit about behaviour modification things. So that I think there's a lot of detail we don't know, obviously, because it's just the question of what we got in the question here. But it sounds like there's some resource guarding or owner guarding going on, possibly. So the way to address that again would be they're both older dogs. If the behaviour of the Blue Heeler is changing, is a 9-year-old dog, needs a vet check. I know you probably heard that every single time. But it is it's really important. So it's so from what I gather is that the staff's behaviour hasn't changed. The Blue Heeler's behaviour has changed. It's a 9-year-old dog. Needs a complete workup. So we'll need to check if there's underlying medical issues. My first go-to to check for pain. When dogs and people are in pain, their threshold again just really can go really low. So I don't know if you may have had that experience yourself. Is you're sore, maybe you've got a headache. It might take very little for you to lose your temper, just because you're just already on edge. And something that's usually completely insignificant might make you angry or cranky. And then also keep in mind that if those dogs are out together and you come out and they all possibly all get excited and start moving and jumping around, one dog bumps into the other and one's sore, well, that's quite often the reason that arguments or fights can start, because the Blue Heeler may feel like that staff is hurting him. Not always, even so, it's obviously not intentional. It just happens in the moment. So vet check first stop, see what's going on there, and I would really look at getting a trainer to help you with helping you see if we can change the behaviour of those two guys when you're out and about. So have a bit of input on that.
So I would be firstly using some management, like Ingrid said. If the dogs are jumping around, and the staffy, I'm going to assume is probably weighs a little bit more than the little Blue Heeler. So it can be, that can irritate them as well. But management, having one behind a baby gate or something similar with an activity while you do get to spend time with the other dog. We definitely don't want to have it where you feel like you can't, spend time one-on-one with one particular dog, because then our relationship with our other dog can start to become a little bit tainted, because we're holding them, in bad taste to say, because you can't, spend that time with the other dog. So lots of management, lots of calming activities, just to teach them that they can be okay near each other. That would be where I would start. But please feel free to reach out to a trainer, a behavioural trainer, and they can help you on the right track.
Okay, thanks, Zoe. I think that's it. Let's just wrap it up here. We've gone a lot longer than we thought we would. We really hope there was some helpful tips and information in the presentation, and we could just answer at least part of some of the questions, and put you on the right path to help your dogs out. Thank you. Thanks for listening.
Yeah, thank you so much for listening, everyone.
Wow. Jesus, what did I say? We weren't going to go this long. I talk